Hi, this is James with HealthQuest Infusion and Specialty. Today we're going to be talking about how to administer your IV medication at home. Hopefully you received one of these in your delivery. It's a SASH illustration guide to kind of show you how to give your medication. It's got all the steps here in picture format. You've heard me say the term SASH. It's S-A-S-H, which stands for saline, administered medication, saline, and heparin. It's just a little quick way to help remember the order that we're going to be giving all of these items in. If you did receive a SASH illustration guide, I would actually just recommend laying it out on the table so that you can follow along and actually place all of your items onto the pictures that correlate with each item so that you know that you didn't forget anything. Before we start anything, we're going to make sure our hands are clean. You need to wash your hands for at least 20 seconds with soap and warm water. If you have antibacterial soap, that's best. We also need to make sure that the surface that we're going to be using to lay all of our supplies on has been cleaned. Your medication will be stored in the refrigerator, so you need to make sure you take this out 30 to 60 minutes in advance and just set it on the counter and let it warm up so that you're not administering it ice cold. Once you've taken your medication out of the refrigerator and let it warm up for a little bit, we're going to go ahead and gather the rest of our supplies. So we have our medication ball, which we're going to lay right there on the picture of the medication ball. We also have 2 saline syringes. They have white caps on them. We'll lay those out. And we have 1 heparin syringe, which has a blue cap. You're also going to need 4 alcohol pads. So now we have everything laid on our SASH illustration guide. We're going to be moving in order from left to right. There's really not much to think about once you've laid everything on this mat. You're simply going to be going step by step from left to right. Today I'm going to be demonstrating the SASH procedure with a fake PICC line, or it's actually a real PICC line that we've just taped to my arm, but I'm going to pretend that I'm you, the patient. And my particular PICC line has 2 lumens. Yours may only have 1. So we're just going to be using 1 today for this demonstration. We've already washed our hands. We have our clean surface and all of our supplies laid out. Before actually beginning the procedure, I would recommend removing all of the wrappers from the saline and the heparin syringes. So we have, besides our medication ball, we have 2 separate types of syringes here. We have our saline syringe with a white cap. It actually says sodium chloride on the label. It's basically sterile salt water. It's used for rinsing the line before and after your medication. The other type of syringe that we have here has the blue cap, and it's heparin. It is labeled heparin right here on the side of the syringe. Heparin is an anticoagulant or a blood thinner. However, this is a very low dose heparin. It's only meant to protect your line from forming clots in the line during your therapy. Once we've removed all of the wrappers from the saline and the heparin syringe, we're going to go ahead and remove a small bubble of air, which just comes from the manufacturer this way. It is a very small bubble of air, but we still do recommend removing it before placing any of this product into your line. To remove the air bubble, we're going to unscrew the cap, hold the syringe straight up and down. That air bubble will rise to the top near the tip. We're going to pull back on the plunger just a little bit to loosen it up and then advance it forward to push any air out the top. Once you've removed the air from the syringe, you can place the cap back on and set it back on your SASH illustration guide. And then I'm going to just continue to do that with each syringe on my mat here. Something else to note is that every brand of PICC line is a little different. You may have clamps on your actual PICC line. Before you can begin infusing any of these products on the SASH illustration guide here, if your line does have a clamp, you will have to open that clamp, or else nothing will be able to enter the PICC line. The PICC line I'm demonstrating with today does not have clamps, so I won't have to unclamp anything before starting. So now we're going to begin the actual SASH administration method here. Starting from left to right, the first item on our SASH illustration guide is an alcohol pad. We're going to tear this right down the middle just to make it easy to remove the alcohol pad. And we're going to place it on the tip of our PICC line extension here. We call the tips of these claves. So you'll place it right onto the end of the clave, and we're going to scrub this for about 30 seconds to remove any germs from the tip of the PICC line. After cleaning the tip of the line, let it dry for a few seconds before moving on to the next step. Once you've cleaned this, you need to keep all of your supplies within arm's reach, because now that we've cleaned this, we cannot set it down. If we were to let it go and drop it for some reason, we would have to clean it again because it could have become contaminated. So the next step is take our saline. At this point, you may feel like you need a third hand because we have to remove this cap and we can't set down our line. I typically just use my pinky finger here and unscrew it like so. To attach this, we're going to press in and turn to the right. You're only going to have to turn it maybe a quarter to a half turn until it's snug. Don't over tighten it. Then we're going to simply push this entire 10 ml syringe of saline into your line to make sure that it's working properly. Now we're going to move on to step 2. We've already flushed our line with saline, so we know the line is working properly. We're going to pick up the next alcohol pad, tear it in half, and we're going to clean again for 30 seconds to remove any germs from the tip of the line before administering our medication. Before hooking up your medication, you do need to read the label that's on your medication ball and make sure that your name is on it, that the proper medication is in this ball, and also that it has not expired. There will be an expiration date or a do not use after date on the medication ball label. So I'm still holding on to the tip of my line now that it's been cleaned. The tubing for storage purposes is bound up with a small piece of paper which you can just tear off, and then this tubing will stretch out to give you some room. You're going to remove the cap by unscrewing it, and then you're simply going to push in and screw it right onto the tip of your line, just like we did with the saline syringe. Now that we have the medication ball connected to our PICC line, we're going to find this small white clamp that's on the tubing connected to the ball, and we're going to open this clamp. This clamp basically serves as an on and off switch for this pressurized ball. Now that we've opened our clamp, the medication is going to flow from the ball into your PICC line. Because this ball is pressurized, we do not have to hang it and we don't have to squeeze it. It will flow in automatically. During your infusion, it's best if you just stay stationary while the ball is infusing. If you do have to get up and move around to get something to drink or perhaps go to the restroom, you do need to make sure that you're very careful because you've got about 3 or 4 feet of tubing here that could get snagged on a doorknob or other furniture in your house, and you don't want to accidentally remove your PICC line. Something else to note is that once you've begun the administration process, you will not be able to tell if the medication's actually running or not. In the hospital, you can see medication dripping from your IV pole, but with this little ball, because the tubing is clear and the medication is clear, you may not see much happening. What you're going to have to do is wait about 10 or 15 minutes into the infusion. You will notice that the size of this ball has begun to shrunk. You'll know that everything is okay. Once the estimated time on the label has passed and your infusion ball looks something like this, completely shriveled up, you'll know that your infusion has completed and you can disconnect the ball from your line. Now we're going to disconnect our medication ball. Simply unscrew it, and you're going to simply place this into the trash with the rest of the supplies. Now that we've finished administering our medication, we need to proceed to the next step on the SASH illustration guide, which is to rinse the line with saline. We're going to clean the tip of our line again with alcohol for 30 seconds. Remove the cap from your saline. Attach it the same way as last time by pushing in and turning to the right. Then simply press the entire amount of saline, just over a few seconds, into your line. The next step on the SASH illustration guide is to flush the line with heparin. We'll take our next alcohol pad, clean again for approximately 30 seconds. We're going to remove the cap from our heparin syringe, and we're going to connect it by pressing in, turning to the right. Then we're going to infuse the entire amount of heparin over just a couple of seconds. Once you've completed your infusion process, all of the supplies that were used can go into the regular trash can. To secure the extensions that are placed on your PICC line in between infusions, you'll need to look in your supplies to find this piece of elastic tubing. This is actually a sleeve that can just slide up over your arm to help secure this tubing. I'll show you how to do that now. Most patients will gently wrap this around their arm very loosely, just to hold it in place while they slide the sleeve up over the tubing. Now that your infusion is completed, you're all done until your next infusion time. If you have any problems or concerns, you can give us a call and reach a nurse or a pharmacist 24/7.